Right. Right. Well, good morning, everyone. Good morning. It is a pleasure to be with you all today. We ask that if you all are joining the call, please, again, feel free to turn on your camera if you feel inclined to. We would love to see your face and just help the engagement to make it feel like we're sharing this community, holding this space together. But my name is Charnay. My name is, again, Charnay Sanders. I serve as the program manager at COACT Detroit. My pronouns are she and her. And I've been with COACT since 2019, and this by far has been one of the exciting parts of my job is this Nonprofit Wellbeing Series. But before we dive in, because I recognize you all could have been anywhere doing any other thing in the world right now, especially with so many Zoom calls, I just want to thank you all for showing up today, personally and professionally showing up for yourselves and for your organizations on this exciting topic that we're going to be talking about. But in honor of May being also Mental Health Awareness Month, if we would like to just start off, and I invite you all to just close your eyes, if we could just do a collective breath to get connected into the space. So if you would like, you at this time, you can just close your eyes or lower your gaze and just pay attention to your natural breathing pattern. Some of you may be breathing a little higher or faster or a little slower. And then if we can just inhale and then exhale and then breathe in again and then breathe out. And then one final inhale and then one final exhale. And whenever you're ready, you can open your eyes and come back into the space. Thank you all for breathing with me, and thank you all so much for being here. Again, my name is Charnay. It's a pleasure to be with you all. And I'm so excited to be kicking off the first session of our Nonprofit Wellbeing Series. So this series, I see some familiar faces and names already, but if you're not familiar, we kicked off this series back in 2019. And for this series, our main focus is to bring people together because we recognize the most important part of any organization is its people. And specifically, we want to make sure that we are talking about the vital connection between caring for our communities and caring for ourselves. So over the past years, we've been able to explore topics around burnout and emotional intelligence and strategies on centering well-being on staff for the organizations. And today, I'm so excited to be talking about compassion and belongingness, topics that are becoming more and more popular in our sector, and then something more deeper to uncover. So today, it brings me great joy to have Dr. Leah Weiss present with us today to lead this session on how we can cultivate more compassion and belongingness within our teams. Leah is a mental health expert at Stanford and the co-founder of Skylyte, a company focused on building healthy teams in a hybrid work world. She is also the principal teacher and founding faculty for Stanford's Compassion Cultivation program, conceived by the Dalai Lama. Her work guides the mental health and well-being strategies for over 100 companies and has been covered by news outlets around the world, including BBC, the New York Times, TED, the Financial Times, and Harvard Business Review. Without further ado, I would like to welcome Dr. Weiss, Leah, to our virtual stage. And if you all can put your physical hands together or virtual reaction hands together to welcome her, that would be wonderful. Thank you so much for joining us today, Leah.
Thank you so much for having me. I've been looking forward to this session with you all so much. And I've been so impressed with COACT Detroit through our collaboration to just get to here today. Really inspiring people and work. And the goal I have today is to share some information that you can hopefully find useful for yourself, for your organizations. And I'm going to build in some reflection and processing time, questions. I'm going to ask you questions because I know for adult learners, as Sharnae said, we are all extremely busy, and I want to make sure that we make great use of this time and that it's relevant to you. So I'll be looking to your support in co-creating a great conversation today. I also want to say that, I love working with folks like you who are doing this important social impact work. My roots are as a social worker before I kind of got lost into an academic PhD kind of thing that I never expected to be teaching at a business school, or the fact that I ended up here. I think I'm going to share some of the thinking about how things like belonging and compassion overlay in social impact as well as industry settings. And I think there's a lot of problems. And actually, one of the questions that one of you submitted prior to starting this workshop today was naming how do we de-weaponize ideas like belonging. And so there's a lot of problematics. So I want to name that, but I'm going to also share some of the constructs, the research-based tools for increasing compassion and belonging. And I'm going to rely on you all to help create a conversation that also, questions. I think I've been teaching about compassion and compassionate leadership for about 20 years. And I think of those 20 years of conversations about what does compassionate leadership mean, the most powerful conversation I've ever had was raised by a student. One of the co-founders of Blavity was in my class. If any of you are familiar with its African-American media, incredible. And he raised the important question of like, okay, we're talking about compassion, but how can that become a problem when we lay in race and power dynamics? So these are real questions, and I want to just invite you to be critical and to be engaged and to make this useful for you. I've done a lot of work with Stanford Social Innovation Review and foundations largely funded through tech money because of my location in the Bay Area. So I'm also really interested in expanding my thinking, and I've enjoyed the time that I've gotten to spend with the University of Michigan and a little bit of time in Detroit through their positive business work. So anyways, without further ado, I love dialogue. So put things in the chat bar, raise a virtual hand. Sharnae will help me keep an eye on that. I will plan times to pause and do exercises and discuss, but I also love freestyle and, kind of interruptions that are along the way. Let me start by sharing my screen. All right, and then I'm going to put this into slideshow. Okay. So as I mentioned, I've been teaching at Stanford Business School for some years, and a really interesting evolution from my perspective. When I started, one of the most kind of famous, renowned faculty members, one of the few women who was a tenured faculty member at the time, she came up to me. I was asking her, any advice or tips as I'm starting to teach in this environment. And she said, not really, because, from my perspective, compassionate leadership doesn't belong here. We need French in the university, but it belongs across the street. Likewise, compassion, not in the business school. So we went from that to about 8 years later, a complete rethinking of what are the core competencies for leadership broadly, and compassion, courage, curiosity, humility, very different than the kind of like ego, power through, force, push kind of ethos that I think had preceded it. So there's a lot, we're in a time, I would say, even within for-profit, there is a lot of questioning around how do we do these competencies? What do they look like? And what do they look like in social impact sector? Where, by the way, some of the topics I'm talking about, like burnout, like can be the most challenging, right? Burnout levels in nonprofits are way higher even than in most for-profits. So I want to invite you. We had such a lovely brief meditation with Charnay before we started. I'm going to just give you a few moments to kind of sift through your own experience. And it doesn't have to be meditative. You can jot down in the chat bar on a pen and paper. What would you assess your experience of embodying compassionate leadership yourself within your organization? What's it like? What's the climate? What's the culture like within your organization when you start collaborating and reaching beyond your organization? How does compassion take shape? Is there a lot of it? Does it not feel compassionate to you? Where is it? Where isn't it? Let me be quiet for a moment and just let you kind of self-assess. And feel free to put some thoughts into the chat bar. One thing I want to name up front when we're talking about a topic like compassion, there's a few problems. We all, I think, and correct me if you don't feel this way, I think compassion is a value that we all agree on. I worry when, because I've been working in this compassionate leadership space, I've been working with compassion training. A lot of people over the years from around the world who do social impact work have come in to train in the methodology. How do I teach a class on compassion? And to me, the first thing that my alarm bells go off of, great, if we want to focus on increasing our compassion, thinking about organizational compassion, wildly problematic if you think that your main message coming in, particularly if you're a person of privilege, into working with a community, if you're going to go tell them to be more compassionate, that's weird, right? So that is piece number one. I'm raising this as something that we look at in ourselves, in our organizations, and we then raise understanding and the recognition of how compassion is expressed in different environments and cultures. And then the second piece, when I asked you what's kind of your self-assessment of compassion right now, one of the things that I think is really problematic and can lead to burnout in social impact settings is when the mission, the purpose that's got you there, the work that you're doing even is reflective of compassion. You're there helping, supporting people who are suffering. But if the internal culture doesn't feel that way, if the way people are treating one another in the day-to-day, often in service of self-sacrifice and the mission is more important than anything, which may be true, but when it erodes within the organization, that mismatch, which us academics call moral injury, when you are in the place of stepping outside of your values in order to do something even important in the world, that rub of, my team, my boss, our funders, the board, whoever it is, we treat each other like dirt, but our mission is great and impeccable and I believe in it, that leads to so many problems over time. So I want to name those components. There's a lot of ways to define compassion, even within like the research community. Recognition of suffering, I think we can all agree on. And by the way, that's where problems like we have in-group bias. So we don't recognize suffering as readily in people who don't look like us, or we don't automatically appraise as being in our in-group. So that can then already, the willingness to lean in and alleviate that suffering, if we have dehumanized the person who is suffering, we're going to immediately have less willingness. So built into this definition here is like an attitude of, can I recognize and am I willing to support? Then some people debate the question of, should behavior be part of this definition? So can we measure compassion by watching what people do? Or do we measure it by measuring what people think? Or do we measure it by what's happening in their brains when what we understand is the compassionate firing response is happening? So there's a lot of interesting, and those questions actually have practical implications that I'll get to. So I think, from the very ground up, this important point, it's true in healthcare, it's true in any social impact work, the expectation that we can be immersed in suffering and loss and not be touched by it, is as unrealistic as expecting to be able to walk through water without getting wet. I looked through the list of organizations and missions that those who'd registered today work for. I mean, you are all engaging with suffering. You are all engaging with loss. And so I think starting from this understanding that it does impact you, it does impact your people. So what do we do with that? What does that mean? The expectation should not be that we are robots and it doesn't impact us. Nobody wants to be supported by a person who is shut down in that way. So where do we go from here? So I mentioned a little bit when I talked about the definition of compassion that there's a few components of it. The first is we have to recognize suffering. And there's a lot of things that can stop that. It can be that we are distracted. It can be our technology. I had my mother, she's fine today, knock wood, but we spent a night in the emergency room on Saturday because we thought she might have been having a heart event. And I was there with some of my family members who rushed in, and I was just noticing our desire to lift out the cell phones and just do anything to distract, right? So there's the distracting from pain, but there's also the being distracted and not recognizing pain. And actually the person who called it out was the teenager in the room, which was, on brand and perfect. Then this piece of appraisals. Appraisals are automatic kind of how we read the situation. They're not even conscious to us, right? So you might have the appraisal of, just something about me or something I've said that you don't even recognize triggers a belief about me, that kind of work. The appraisal that the person needs and deserves help, that they're a human just like me, that their suffering is just like mine. This is a place where in-group, out-group, even we do a lot of work in the longer classes on compassionate leadership, breaking down how are stereotypes formed and how are they challenged. And there's all these complicated ways where we assess people as either more or less warm, kind of likable and competent, and depending on where we put them in these models, if we see them, a classic example is if we have political beliefs about factors that drive welfare or homelessness, then when we encounter someone who's in a situation that we have a belief about, compassion can be blocked if our beliefs lock us in there. So the compassion training process means understanding we are all going to have constructs. We have all internalized a variety of them depending on our education and our culture and our experience in life. That's a given, but what we can get much better at is recognizing and not being propelled by them. So then this third piece is also complicated, making the appraisal that I have the capacity and resources required. So I may see someone who I do recognize their suffering. I do believe in have the experience that they deserve and need help, but I don't, how am I as an individual, either the social problem is so big here in Portland, how could I possibly handle responding to all of the homelessness, it's overwhelmed, unhoused people experience, or just simply it can be a colleague who I can tell is having a really off day, could probably benefit from a conversation, but the bottom line is I got to go pick up my 8-year-old at school or I'm going to start, I'm going to be in trouble there. So I don't have the resource of time. So there's different ways that the resource blocking happens. And I think when we're trying to create social change, it can be really helpful actually to use some of these constructs to analyze where are the blocks happening. Are they an in-group, out-group bias kind of block? Are they resource blocks? Where is this? It hasn't risen to the top of perceived importance? And, the truth of the matter is we have record heights of inclivity is like the academic word for workplace rudeness. bullying, even violence. So we're living in, and guess what? Not surprising to all of you, as we're about to enter into an election year, do we think that this is going to settle down or escalate? It's good. I know my hypothesis. So here's the other piece, and this is probably the most important part of my soapbox about well-being in organizations and building resilience, that when we only focus on individual strategies, we will fail. And I think Dr. Christina Maslach, the godmother of burnout research, has really put a perfect metaphor to place for why we fail if we only put the fixes for well-being on individuals. She says we should be trying to identify and analyze the critical components of bad situations in which many good people function. Imagine investigating the personality of cucumbers to discover why they'd turn into sour pickles without analyzing the vinegar barrels in which they'd been submerged. So I want to pause for a second, and I have shared this quote thousands of times. I've thought about it for thousands of hours, and it still continues to deepen for me every time I think about it. Right? From when I think back to like training as a social worker, person and environment is like the key structure. Yet how complicated it is to remember that. And, wellness products, tech apps, all strategies, it's a lot easier to build something for personal relaxation than it is to understand what is going on in the vinegar in this environment and how is it impacting people. So I think there's a bias towards personal wellness because it's simpler, because there's a lot of tools to sell that are great and, kind of easier. If you start looking at questions around team and system, organization. Sorry, give me a sec. Bye, baby. Go to school. Good luck. It's a little earlier here. What are we doing to analyze the vinegar? That is a more complicated question. It takes assessing what is the composition of the vinegar, how did it get there, what is the right antidote to it, and how is it impacting people? And it impacts different cucumbers in different ways. So one of the key things that I think becomes important out of this messaging is I'm not negating the importance. We have to have individual wellness strategies and resilience strategies. Personally, I spent 10 years of my life doing silent meditation retreats for 100 days, 6 months before I had these kids that are rudely interrupting. And that all is great. And then I got into, the real world and doing work, and it kicked my butt because it's not on its own enough, right? So let's think together about what might it look like to focus on bigger increments than just the individual. So, pardon, just gonna take a sip so I don't sound like a horse. I've been known. Okay, there we go. So, and culture level work takes years and a huge amount of resources. I do work with this amazing woman who she's president of a community college, one of the biggest ones in the Bay Area, first African-American president, certainly first African-American woman president of a community college. And we were talking about the Aspen Institute does work for emerging and currently serving community college presidents. And we were talking about just what does it look like in the context of like one community college and one community to change culture. And she's bringing a bunch of her colleagues from other community colleges who have been in these initiatives for longer. She's in her second year. And most of them said it was over 5 years. It was between 5 and 10 years to make true culture change at the level of a community college. When I've interviewed people in for-profit settings like biotech, a company that's put a lot into it, they said 5 years. So it's important, again, like individual, I'm not saying we don't want to do that work, but it's a bigger project. So let's understand that. But at the team level, there is a lot that we can do. And because it's smaller, because we have more agility And one of the questions that came in ahead of time was like, what can we do if we're not the leader of the organization to promote resilience, well-being, and so forth? I would suggest starting at the team level. Can you bring in conversation starters, check-ins? Can you do some measurement? And I'll talk about how we do all of these things, but focusing first on your team. And can you turn your team into a port in the storm instead of an additive of stress, which for many people it is. And as the cliche goes, you don't leave a job, you leave a manager. And managers predict 75% of churn. And so this is something we want to pay attention to. And I'm of the belief, and I'm curious what your thoughts are. I don't think people set out as managers to make other people's lives hell. I think they become burnt out. They were not trained in the resources of how to run a healthy team. And the more you're burned out, the harder it is to pay attention even to others' experiences. And if you don't have the skill set, very difficult. At the team level, if you can set up a team that has this training, that has this understanding, has some of this focus, you can support each other. It's very hard to self-diagnose burnout, but other people see it in us, people who know us well, they see it in us before we often see it in ourselves. And we spend most of our time in our teams. Many of us spend more time with our work teams than our families, like it or not. That's just like the way, the waking hours, that's the way it works. So what I want to focus on next, let me pause here before I kind of move into the team health section. And I want to scan back through the comments that are in the chat bar and also invite any reflections at this point about what I've shared so far and how it fits together with your experience. Here's one question. We are recording, so you can share it with your team, and that's a great first step. Me asking for fashion advice. Let me see. Examine urgency. Yeah, it's such an important one. Important, but not priority is very difficult to overcome. There's a lot of compassion towards community. There's not enough compassion when it comes to workers, subordinates as they're going through similar circumstances or just life. I would love to see if you'd be willing to expand a little bit on your thoughts behind this. I think it's a really powerful comment, but don't want to put anyone on the spot. And I also know people might need to like hop away and come back. Umi, is that how I say your name? Are you available to expand on this comment? Or if anybody else wants to jump in off of that, I think it's a powerful one. Maybe not available at this moment, but oh, here. Okay, so I think some of that comes back to we can get focused on all the core values towards the communities, self-sacrifice, and we don't matter internally because the mission is so important. And so part of the role of leadership in social impact work, I think, really comes back to saying we need to walk the talk. If we're in a community doing this work, we need to be doing it internally. We need to be doing it with ourselves, with everyone we're interacting with. And if there's people that we're excluding from this kind of circle or lens of compassion, then that is important to address, not just solidify. Fear can drive a lower compassionate approach. Yes, I think that is such an important point you make here, Alyssa. The more stressed we are, we don't have capacity. We don't have even that first step of recognizing suffering. If we are experiencing our own anxiety or kind of existential concern, it becomes very difficult to even notice in a real way. And that is for sure a real blocker. Oh, gotcha. Okay. Yeah, we can come back to this later. Thank you. I'll pause again and we'll have more discussion shortly. So I'll bring it back up. So let me talk to you a bit about foundations of team health. What I have been trying to do when I myself was making the transition, as I mentioned, I did a lot of work with mindfulness and compassion in organizations, really focusing early in my career on individual strategies. So what can we do as individuals to do this work? And in the last, I'd say like 7 years, have really been trying to augment that because of the pickle metaphor, because I saw time and time again, if I'm going into a hospital, into a nonprofit, into a foundation, and I'm just talking about the individual, then in some way you're almost, if the individual can't resilience themselves, then it's almost their fault, is what you're implying if you're just doing an individual approach. So I quickly realized, like, I'm not comfortable with that message. That's not what I want to be communicating. So what can we do at the team level that builds on this idea of resilience? And it includes, so if you look at this team awareness, what is team awareness? It builds on emotional intelligence, mindfulness, compassion at the individual level. So we know how our personal strengths and weaknesses impact the group. So that requires a good amount of mindfulness, self-awareness, right? Understanding how we're showing up when we're stressed, when we're afraid. But next level of how does that impact other people? So not just emotional intelligence of what goes on with Leah when she's stressed out, but like, what does that mean for all the people on my team? And when you layer in power dynamics, what does it mean for, someone who reports to me, who works for me? I might treat him very differently when under stress than someone, an investor or the dean of the school that I'm teaching in. So building on what are my strengths, weaknesses, habit patterns, and then recognizing each other's needs and triggers. This is so important to have these conversations, which we often don't have. So there can be even small things like, for me, I was always brought up with the idea of if you're not 5 minutes early, you're late for a meeting, and it communicates disrespect, right? If you're late. And I'm still late a lot of the time, and I understand that more in a nuanced way now, but I still have the reaction if someone shows up for a meeting with me late, especially if it's like an internal team member. So I'm annoyed, right? But I may not name that. I'm just gonna that builds. So understanding what are these things, and some people don't have that. Like the other people I work with, like they really don't care. They're not personally wounded if I show up a few minutes late. Not a thing for them. So these are the kinds of examples. Understanding each other's values. So we all know we have to build purpose within our organizations, but doing the work on what is the person's experience behind that purpose. So if I'm a colleague with Charnay, it's actually really important for me to not just know what are her 3 to 5 core values. So, and in what scenarios do they get disrupted and cause her pain and frustration, but also the narrative. What is Charnay's experience, life experience, that has led her to have these values that leads her to show up in this way? And that may sound like work that's like, who has time to do that? But there's a lot of tools that I've developed and others have developed that we can use to do that kind of process efficiently. So to build a sense of team awareness through sharing, through check-ins and other exercises, what are our trigger points, what are our values, what is our condensed version. I did for the Stanford Alumni Association right before the pandemic. We had set up a purpose boot camp, and basically it was an experience where people would get together, and the first step of it was sharing their life's narrative within 9 minutes, 3 minutes per chronological third of the life, and then extracting values. So in a process of basically 30 minutes, if Charnay and I were colleagues, we could grab a coffee, do that process, and come out of that experience knowing each other's history and values so much better. And that, imagine how that would impact our day-to-day ability to work together. I've heard people start to take versions of this and bring it into interviews when they're hiring and offsites. So just to make the point that we can do this work in bite-sized ways that could be compatible with how busy we are. And knowing, again, all of your organizations have great missions, but do people experience a personal connection with them? How much are they experiencing it? Are they experiencing it in the day-to-day when they're doing the frustrating or mundane repetitive work? That becomes, that's a whole other talk that we can have about how do you begin to do this work of not just relying on a purpose existing, but continuing to build purpose over time and doing that as a leader at the team level. So team awareness, I just spent a lot of time on it. I'll be quicker on autonomy. Autonomy is so important though. When we're in teams, having a balance between feeling supported and feeling like we have room to breathe, move, be creative, make mistakes. So we don't want to be micromanaged, but we also don't want to be untethered where we have a mountain of work, insufficient resources, and maybe we are overwhelmed with how do I solve these problems. So somewhere in between those two extremes lives a balance of autonomy. And even for any individual, that's going to change over time. It can change seasonally. Like I and many of us want a lot more kind of time autonomy when the kids are out of school in the summer, or for different reasons, things happening in our lives. The power of giving people an opportunity to talk about how the work gets done and not skipping over that step. I've learned this in my own small way. I was brought up in a very kind of traditional academic culture. So you learn by being told by someone more senior to you, here's the process, and you start to implement it. And over time, it's like you get more and more pieces of that research puzzle. But when I've started in the context of doing work at Skylyte, where we apply with organizations these principles, I've really learned like the people on my team are a lot more invested if I don't just say, go do blah, 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 I map it all out for them, but I give them the kind of dignity of saying, here's the problem that we're trying to solve. Why don't you take a first pass at how you'd approach it? And then we have our first meeting from there. And for sure, I'm going to have questions and clarifications and hopefully bring my experience in. But I'll tell you, a lot of the time they come up with really great stuff I never would have. But it was a big switch for me, right? And I think for many of us, it's a different kind of leadership than we may be used to or not. And if you're doing that, great. So the support and flexibility, and this can be really pragmatic support too, like time zones, life stages, all kinds of things. I have a coworker who's European living in the States, but they eat dinner at like 9 at night, but they're on the East Coast. So it's like protecting that time. She would be happy to, talk again at 10. But like, that's so different from my worldview. I would fall asleep with my youngest at like 8:30 if possible, right? So understanding what are people's lives, what are their time zones, what are their priorities, how are they guarding them, which then fits into the next pillar, which is structured rest, which we are terrible at in this country globally. We don't take vacations. If you've seen the meme for European versus American vacation autoresponders, the European one would be, I'm on vacation, it's July 15th, I'll see you August 15th and I'll get back to you. The American one would be, I'm on vacation, here is my cell phone number, text me if you have any questions, right? Like if we're not even starting from the idea that the organization could live without us, or we could structure our work in a way that enables us to be extracted and the work to continue. Individual and team guardrails, it looks differently in so many different organizations. If I was working with a cardiac physician group, like their boundary opportunities are going to be very different than I'm working with a philanthropic organization that doesn't have call in the middle of the night. So it's going to be different versions, but whatever it is, even the cardiologists who do emergency room work, there's a way for them to work together to support one another so that they can have rest at the end of the day, that work can be distributed, that additional resources that help transition. All of this becomes an important conversation. And at the team level, I think one of the things that people can say is, it's just especially model what you're trying to do. Just don't respond at night and take your vacation. Very easy to say that, but if your team is not supporting you and that's not the culture that you're in, you actually can't do that if you're not the leader. And if you are the leader and you feel like you're so important, I don't mean to diminish the fact you are certainly important, but also be cognizant that if you're sending the message to your people that they are never able to be unavailable and rest and recharge, you're going to burn them out. And better to spend the time and resources to ask, how can I build this infrastructure, and listen at the team level and ask for feedback when when project timelines are untenable, when projects are mapped, that they include the need for different team members to have planned extractions, and then unplanned extractions when life happens. If my mom had ended up in the emergency room right now as opposed to Saturday night, all bets would be off, right? So like, you have to plan for that. If everything is scheduled to the 120% max all the time, you're setting people up to they're never going to meet it. You're showing that you're not realistic as a leader, and you're not going to get the heads up on what's not going to get done. It's just going to result in absenteeism, people calling in sick, falling behind, hiding out, that kind of thing. One more pillar, and then I want to move towards some conversation. The community pillar, so much within it. The compassion, psychological safety with it, which is a whole other important construct. How do you build that? It's related to belonging, but different from belonging, has much more implication in terms of if people don't trust you enough, like in the healthcare context, if there's poor psychological safety, people won't call out when they think there can be a problem. So you actually have worse patient outcomes. If the more junior members of the technicians, if the nurses, if the nursing assistants don't feel safe to say something doesn't look right, then literally the relationships impact patient care. The belonging, we're going to talk more about. Compassion, we're talking about just recognizing that this is work. Like, I think many of us know marriages, partnerships are work. Teams are important relationships that require work on all of these skills. And I'll talk more about belonging, but one of the pieces that I think is well, two things I want to call out. For belonging, it's not just a feeling of I am part of this group. An important part of belonging is also my contributions are perceived as valuable by this group. I feel recognized. I feel seen in what I'm contributing. And I think often when we talk about belonging, it's much more in the sense of like, am I comfortable? That's a part of it. But like, maybe I'm comfortable to have a conversation, but I don't feel like anybody respects what I'm here to do. Then you don't feel a sense of belonging if you're lacking that. And then the other thing that I want to say, because I'm not going to do a lot on psychological safety today, but this is kind of my one soapbox point I want to make. Often when we talk about psychological safety, we go straight to like, let's build trust by being vulnerable. Great, except for being vulnerable can be very re-traumatizing for people who have various forms of trauma. So just opening up an emotional kind of believing that emotionality leads to psychological safety is false, and it can be harmful. And another really important thing is if you're working on building psychological safety, we focus often in these trainings, when I read the articles that people write in leadership, it's like all of the things you're saying and doing, but actually what undermines psychological safety is what you're not doing. If you're not the term Dr. Amy Edmondson, who's written and researched a lot of around psychological safety, she calls it sanctioning. You have to sanction unacceptable behavior in the context of a group. So if you do everything else right to create psychological safety, but I'm ignoring when somebody is committing microaggressions towards Charnay, I can do all the sharing of my vulnerability. My mother was in the hospital, blah, 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 all these things that are true. I don't mean to minimize them. But if I ignore it, when Charnay keeps having someone interrupt her or take credit for her ideas or disrespect her in small microaggression ways, is Charnay gonna experience psychological safety? Absolutely not. So just want to make those points, because when we read this work, we do this work, that's like often something, it drives me crazy because we focus on like problematic, almost oversharing, as opposed to like getting, so what can we do when we talk about community to build belonging? I think starting with compassion at the individual level, at the team level, at the organizational level, and then taking these topics in a systematic enough way that we don't fall into those kinds of blind spots, right? Of doing 7 of the 8 things, but not learning. It's a difficult skill. How do I interject if someone is committing a microaggression or systematically committing microaggressions towards Charnay? Am I trained as a manager to know what to do there, right? To have the communication skills, because it's not going to help build team if I blast that person so hard and then they're pissed and then they're going to come back and do it even more when I'm not in the room, right? So like, what is the way of approaching that is going to be effective? Those come back to kind of manager training, leadership training conversations. And thinking in creative ways. I remember Anne-Marie Slaughter, when she wrote a big blog maybe 5 years ago about what to do with gender dynamics in real time in team environments, and she came and spoke at the business school. And I remember one of the things she said, just providing the language for people. Like, one of the very common microaggressions that can happen at the team level is someone taking credit for someone else's idea, and the person who has more power or privilege becomes associated with it, and it feels terrible, and it is inappropriate towards the other person. So the language Anne-Marie Slaughter suggested was, if I watched someone speak up after Charnay, basically repeat her idea, take credit for it, then I would have ready-made language, be trained with the idea that I could come and be like, oh, Joe, I love what you're saying. It comes out of what Charnay was just saying a few minutes ago, right? So like, being an upstander, having language in the context of the team. And I don't have to be the manager to say that. It might be a riskier move, let's be honest, if I'm not the manager. But it's still, if we have this kind of training awareness to be looking for this and ready-made responses, that goes a long way. So curious to open up the conversation for a bit here, before I get more kind of tools and a little more research going. How do you feel your team is doing? How do you feel your organization is doing, if you're in a leadership role or not, in kind of preparing your people to work on these skills? What's going well and what could you improve? Sorry. And I'd love if anybody wants to unmute and speak up. Yes, Jinx, Charnay, feel free to mute or drop off mute or drop yourself in chat if that's more comfortable. It's so challenging when you're not the manager to feel overshadowed 1,000%. And I think this is one of the places, like, I talk to my kids all the time about being an upstander. And it's like, this, if we all do this with each other, because it's easier actually to do it for someone else than when it's happened for us. If that same person did the example that I was talking about with Charnay towards me, I'm going to be upregulated, right? My heart's going to be beating fast, whatever triggering physiological response. And I'm going to be worried about, am I going to say something inappropriate because I'm having trouble filtering because I'm triggered in this moment, right? So how powerful to have Charnay step in and say something for me, as opposed to putting the onus there and on me, And I also, as I'll get to later in the presentation, some of this team level work, it's really important to have good anonymous measures that go back to the team level so that you can have a place. It can't be a team of 3 giving this data back because it's going to be obvious who said what. It has to be a big enough number. But if we, let's pretend group of us is a team and I was to query you about your experience of the team, we get that data back and then we start not just like, okay, cool, we're not feeling very safe or like we're experiencing compassionate towards one another. But if that kicks off a process of here's where we're weakest, here is the next thing to work on in a very practical way. Here are 2 months worth of check-ins that you can do with your team for 15 minutes a week. And here's a manager training module that you can do so the manager understands the next level of these topics. So love this point. I'm so much better stepping up to support others than myself. Yeah, so another kind of thumbs up for let's do this for each other and let's train everyone in our organization to be upstanding for one another, right? And that's like, and that has to include ourselves when we're the leaders, and we have to like invite that. I was just in a meeting with a leadership group of higher ed, and one of the leader of that leadership group said good morning and used like gender binary language, and a person who was non-binary in the group said that actually makes me feel really uncomfortable. Her response to that real time, and he said he was so skillful in how he did it. He's very well trained in all of this work. He's incredible. But her response and he made the decision to do it real time, which was risky, but also they had that relationship. The group had been doing work with me for a while, so they were kind of prepared to do it. And she was sincerely grateful to get that feedback. We're not all there, right? I'm not all there and every day of the week myself. Our teams are not all there. So doing this work kind of offline too, as you build up your strength in the muscles, can be really helpful too, instead of like diving in the deep end in a confrontational way. Any other, any other thoughts about these 4 pillars? I can put them back up for a moment that occurred to you. I see another comment in the chat bar. Something I found helpful is giving myself permission to follow up one-on-one in writing after experiencing discomfort. Yes, that is great. It's more manageable. I think that's a really important point, that we're not going to get everything right real time. And it's not even better or more right to do things real time, giving processing time, doing it in writing. Maybe someone else could say the same, but I feel more comfortable having a follow-up conversation one-on-one with that person. Or maybe it's, I don't feel comfortable addressing it with that person directly, but I want to engage a resource or person to help resource our working on it. There's so many possibilities if you do what Yarmar is suggesting, of giving yourself permission to not feel like if I don't speak up in the moment, the opportunity is lost. That is really powerful what you're saying. You can wait and there's different strategies. Any thoughts on the other pillars? I was asking specifically about community, but does anybody have anything in place in terms of structured rest? How is your organization doing? Do people take vacation, or do you have your autoresponder with your text on it? What's the climate like for you? No judgment, by the way. Like it's sometimes when we're so under capacity, we have to be in a space that's not optimal for where we would be if we had the resources we wish we had. That's just true. Anybody willing to share their experience on this? My board takes vacations or times away when they need to. So hopefully that then sets a tone where if the board is doing that, then the ED is doing that, the leadership team is doing that, and that permeates. Any other experiences? Anybody experiencing the opposite? We take time as flex time when some of our teams have been overworked. due to Dateline. That is huge. I was just talking to someone in a nonprofit, a leader the other day, and she's trying to implement that for her team, but the ED above her does not want to give that flex time. And that is a really tricky space to be in too, where, you've pulled your people in for an event on a Saturday. It was a fundraiser. They needed to come. They'd been working at 140% for 2 weeks up to an event. And then you're like, seriously, I can't give these people Monday and Tuesday off. Like, really? And how do you have that conversation? So here's another, most of our staff are hourly as a protective measure to deter people from working over 40 hours. Curious, is that effective in your setting? Are people stopping at the 40 hours in this? I'd be curious, Anne, to hear if that's working, because I've heard scenarios where that works and scenarios where it absolutely doesn't. Wow.
Hello?
Yeah, please.
Oh, sorry. This is Anne.
Awesome. Thank you.
I remember when I was hired in, because in previous jobs, I had only known salary, which I liked for many reasons, and I saw as on some level job security. So when I was told about hourly, I remember being a little apprehensive at the time, and they had reassured me, like, your job is secure, but we really do try to help folks not go over 40. And I would say for the most part, from those I work most closely with, they're good about not going over 40. And if you do, you get paid time and a half. So there's also, I think, kind of motivation from senior leadership, like, no, please don't work over 40 because we'd have to pay you time and a half. But they also understand that there are times when you have to get the work done. So it's an interesting model. I personally find a bit of anxiety in it, because it's sort of like, do I, especially in the beginning, I struggled, like, do I go to the dentist? Because if I go to the dentist during the day, let's say that's 2 hours max, I have to now make up 2 hours somewhere else. And if you don't work 40, you don't get paid the 40. So I personally have anxiety with it, but I'm trying to figure out how to manage that.
Yes. And it doesn't carry over from, 3 weeks ago, there was a deadline.
Exactly.
For the 60 that you can go to the dentist with impunity the following week. Yeah. Well, and I think one of the pieces and it's not just because I'm an academic nerd, but I really think, like, when whatever policies or strategies we have, continuing to get information from people about how are they experiencing them is so important, because things can cut either direction, right? Like and there's unintended consequences that we want to keep track of. So thanks for that example. And here's a couple of other really interesting ones. We took a month off after the busiest summer we've ever encountered, and people were appreciative for the respite. I'm really curious too, like, how did they show up again after that month? And when you look at the next 12 months, were they better off having had that month off or not? And if there's ways you can quantify that over time, that can also be helpful for building, if you can show following on this month, the next 12 were massively productive, then you're setting the case for this to happen again. You're also, like, getting the opportunity to be kind of a leader among other organizations by having that we did this, and then that this was impact. And I know, like, not everybody has time to track on all of these, but I'll share a little bit about the work that I do in organizations. Part of the purpose of it is to help organizations who are busy, who may not have the resources to track on these things, be able to do it, so you have the data without having to everybody design and implement. Here's a couple other really interesting examples. Focusing on diligently preparing others to fill in when you're gone. Yes, that way everyone knows who to go to. So doing that prep work. And, people often ask me the question of if that starts the wheel going for everybody around you. And sometimes people are worried about doing that in a more junior position. So an entryway can be then, if your colleague is going on vacation and you're in a more junior position, can you say, hey, I know you're going to be out in a few weeks. I'd be happy to sit down with you and look for ways I can support you actually, like, being out. So you can start it on either end of, like, I'm going out and let's plan for it, which is super important and where you need to end up. But if that feels like trickier than offering to be the bridge for other people, that's another way into that. If that's super important. Time off is necessary, and I insist they take it. That is a great leadership practice. Yeah, it's lacking in your industry. So that can create more fear. That can create fear in leadership. That can create a lot of concern if this isn't an organizational norm. But, and it takes a lot of courage for you to step up and do that counterculturally. This is a great example. Everybody take a look at Rachel's, point that I grew up observing Sabbath. And although I don't do that in a formal way, I apply the lessons that taught me about rest. I never asked for more than 45 hours a week, or my managers, even on salary, even during the busiest season. And I love what the point you're making there. And it's really interesting to me, like if we look at elite athletes, if we look at the military, if we look at NASA, these are all environments that I've done programs, projects with over time. And I'm really impressed by the fact that like, you're not in the military going consistently at a work pace all the time. There's pre-deployment, even if you're going to be going abroad, and there's pre-deployment, there's post-deployment. If you're a professional athlete, there's training periods, there's periods of recovery, and we need to do that for our physical bodies as well as our mental bodies. So how do we bring these lessons from our religious traditions, from our elite athletes, our military, our astronauts, how do we bring those into our settings, and understand that this is the key to sustainable performance and health, and that it's almost absurd, again, coming back to only having individual resilience strategies, if you're in a context on a team, where you don't have structured rest and you don't have a great sense of community, like you can give people all the meditation apps in the world and they're not going to not burn out, right? So you have to do these pieces together. Let me move forward into a little bit. Oh my gosh, it's already 9:04. I could hang out with you all day, but I know you have important work to do. You're too busy for that. But so hopefully, let me get through a few more pieces that I hope are helpful. From an organizational level, I know I've been talking team, but I think it's important to also have some of what would you do at an organizational level, and what could you do, what would matter. So this comes out of the work of a colleague of mine who's actually at University of Michigan, Doctors Moorline and Dutton, and they are scholars on the field of compassionate culture, and they've done incredible work. There's so many cool studies to refer to, but boiling down the ocean of their work, which I highly, highly recommend if this is you want to look at the culture level as your area of focus. So how do you amplify, how do you build, how do you inhibit, what inhibits building compassion at the organizational level? So the values piece, like from leadership, from how you treat one another, this comment we saw before, which is very common. We're great in the community, how we treat each other, but not so much necessarily in all of our other configurations. So understanding this message of walking the talk, doing that work, communicating that through action, building up networks. And this can happen, they're talking about kind of employee resource groups, which are great if you're in a large organization where you can focus on problems like, how do we create more diversity and inclusion? How do we think about intersecting identities in the workplace? But having forums, and I prioritize at the team level when you can as well, to people you're working with, have these conversations where you know each other, you're problem solving, but there's also this basic, like, is there enough comfort? Is there time? Is there opportunity for people to drop in what's happening in their lives, right? Like, and if we don't know that, then we can't be compassionate towards someone else, if we don't understand that they're experiencing or they're afraid for their family members' health or legal problems or economic problems. So we need to have enough relationships that we can drop in the kind of data that I always try to do of humanizing, like, yes, I have children who are going off, to school. I have a mother who's sick. I'm making sure when we're leading, communicate these pieces and ask others about it and encourage them to have those relationships so that, if someone's mother's in the hospital or someone's spouse is in the hospital, there's organizations and people I've spoken to, or they're like, I've had cancer, I've lost a loved one, I didn't tell anyone at work, right? And so they've been like keeping all of that in themselves and not had the support they could have had. So routines, there's so many creative ways of responding, and things have to be individualized. Sheryl Sandberg gave a talk when her Option B book came out, and she was talking about the loss of her husband and running Facebook. And, let's leave aside her as, there's complicated pieces to her, but one of the things, and great work that she's done, but one of the things that I think is really powerful about what she said is, when I went back to the office, I actually really just wanted to immerse myself in my work. I didn't want people asking me all the time how I was feeling and what was happening. Like, the respite was great. But somebody else might feel terrible if nobody else acknowledged what was happening. And for her, it was so public. So there's this extra level that was tricky. So the point I'm making is, what alleviates suffering for Alfonso and what alleviates suffering for me might look different. Right. So it's not one size fits all. And from an organizational perspective, what we can do that really kills compassion, let's say, or ignoring when things are happening as a leader, not talking about COVID, not talking about natural disasters, not talking about if things that are happening because they don't know how to talk about it, that is sending a very loud message. Blocking ideas or legalistic rules, the kind of classic, okay, let's take the scenario out. Let's pretend I'm an employee in your organization, and the outcome here is okay, my mom is actually going to be in the hospital for a long period of time, and I need X, Y, and Z support so I can be there with her. If your response is to, let's see what we can do, roll up our sleeves and support, whether that's through flexibility, finances, you name it, that's one response. The other response could be, hey, well, sorry, Leah, but we couldn't scale this response to everyone in the organization. I can't give you flexibility or pay you full salary if you're not, whatever the thing is. So to protect resources and the fear of having to help everybody in the same way later, we don't do anything now. And so this is a really interesting place, because a lot of big organizations function this way, a lot of small organizations function this way, but the outcome, if you look at it even from a financial perspective, is okay, maybe you've saved a little money to not pay me my 40 hours this week, you paid me my 20, but what is it going to cost you when my mom gets better or she doesn't, and my life frees up and I'm left with, wow, this is the organization I work for. I'm going to dust up my LinkedIn and move on, right? And not only is that, are you going to risk your retention and the need to hire someone and train someone, but if I've been working at your organization for 5 years and I have been all in, I've been there for every deadline and project, and Charnay's on my team and she knows what's happening with my mom. She knows I went to you to ask, can I have some support? And she saw that I didn't. Not only is the impact going to be strong on my engagement and purpose and loyalty and belief in our organization, but Charnay is also oh my gosh, maybe I've started there this year. Leah's been there for 5 years and this is what they're doing to her. So this is what I can expect. Is this an organization I want to make my home for a long term? Absolutely not. So culture gets created, is my point, choice by choice, bit by bit. And sometimes saving in the short run financially costs a lot. And when we're talking about compassion, So some of the pieces I think super important to just name: compassion isn't pity. It's not looking down on the other person. It's not getting overwhelmed with their problem. I don't want my doctor or my social worker to break down in tears when I'm telling them what's happening. I want them to be a source of strength, and I want them to have the boundary. It's me, not them. It's not letting people off the hook. You could have a compassionate response that is sitting a person down and saying, there's a gap between your work and where I need it to be, and I want to support you. It's not just saying, oh, cool, there's a gap, I'm compassionate, I love everybody. So it's not this kind of naivety. And there's actually, research looking at, because people sometimes have this thought, and I always find it so interesting, oh, if I'm more compassionate, people are going to try to pull more over on me. But reading and recognizing suffering in another person makes you more insightful about their experience, including if they're being manipulative in some way, intentionally or otherwise. So we don't have to mix up being compassionate and being a doormat is a key point I'm making. And how many incredible leaders, social impact wise, have been unbelievably courageous and compassionate at the same time. And so I think that to me is a really important reminder to look at what are those examples. And for me, I love studying comparative theology. So I love looking at who are the social justice leaders and what are the kind of the frameworks that they've used from a religious perspective, and kind of bringing more of that forward of what does compassion look like when it's expressed in real work, in real life, and not always in the most friendly, everybody's great, carry on kind of way. So I want to touch on, there's so many ideas that I probably, am overly feel like they're all so important, and maybe to you they aren't, but I feel like this difference between empathy and compassion is such an important one. I remember the first day of social work school was in my early 20s, such an obnoxious do-gooder wannabe. I would not want to sit down with myself today. And I remember, the amazing veteran professor who has been a social worker for longer than I'd been alive, saying kind of two things. One is 5 years from now, what was the number then? It was 70% of you are going to be out of the field, burnt out, gone, right? And then the other huge point that she made was whose goals? When we're talking, interestingly, the word for compassion in Tibetan translates as responsiveness. And I always remember those two things side by side: responding to a person suffering in the way that they want, not in the way that I think is how I would want. And then this empathy piece, that empathy is feeling the other person's suffering. And this is a classic early social worker thing, being so overcome by the client you're there to support, and all your projections on what they must be experiencing. You're useless to them. You're actually a problem for them when you're in that space, as opposed to a resource. Empathy, if you're emotionally reacting all the time to everybody, it becomes depleted. We are not wired to be mirroring and responding. So if we think about empathy, it's the mirror neurons, remembering the mother-infant studies where you see these pictures of the baby, the newborn, mimicking the facial expressions of the mother. So empathy is so hardcore wired into us. It's one of the first things that we do as human beings to bond and connect. But it is a powerful source. It cannot be sustained all the time. And also empathy is hugely impacted by in-group, out-group. So our empathetic response is going to be stronger with people that we identify as in-group. So I want to talk a little bit about the difference between empathy and compassion from a practical perspective. And this is another whole body of work that if you have burnout coming from the perspective in your organization of people being overwhelmed by the problems that they're facing, I would say then it's probably some compassion training work to get people out of being stuck in empathy and into being responsive in compassion is going to be really important. And from a neuroscience perspective, just to like really make it clear, let's go with let's say Asandi and I are in a room together at a lunch break, and Asandi is cutting her bagel in half to toast it, and she cuts her hand, God forbid. But let's say that happens. I'm in there with her watching it. My empathetic response, what fires in my brain is the same exact pain regions as in her brain, who's actually experiencing this pain. So that's empathy. It is powerful stuff. I'm not saying we don't want it, right? Like we need it, but how could we walk through all of our days doing that for every emotional, physical, environmental form of pain we're seeing? There has to be an alternative to shutting ourselves off and being a robot or experiencing life in this way. And so compassion is that. And you know, at Stanford, we brought a group of, these are Tibetan monastics. Compassion meditation, like other religious, compassion is a core value of Tibetan Buddhism, like pretty much all the world religions. One of the interesting things about it is there's very specific meditations on compassion that they do in this tradition. So the question from the neuroscientist, Brian Knudsen, in his lab, he was like, well, let's see if they come into the fMRI machine and we scan their brain while they're doing compassion meditation, what happens? And then he's well aware of the empathy kind of neuroscience I just showed you. So if we go back to this example with Asandi, what is the difference between compassion and empathy? In these images, what you saw was the reward region of the brain lights up when compassion is happening, not the pain region. So that's a huge implication. So if we're experiencing empathy, we're feeling with and experiencing pain. If we're moving into compassion, we are experiencing reward. And so the sustainability of a compassionate response, think about that over time, right? And think about why 70% of those social workers were never going to last, because they didn't, know how to move out of their own emotional distress. I find this really fascinating. I would love to see, I love this summary here. Empathy is debilitating, compassion is empowering. That is so beautifully, I loved how you distilled that. Thank you. So what does it look like to train our people in this, right? And if we could, I've done some work with like bridging this into schools of medicine or, social impact work. I'm really curious about what would be the difference if we bake this into organizational life, and what if we train social workers and all the people who are doing this kind of work to have the response of reward. So I talked about compassion before, the recognition of suffering and the willingness to alleviate it, to be responsive to it. I have been trying to continue to evolve this definition of compassionate leadership for years now. And this is, where I'm at with how I think about it today. And I'm very curious if it resonates or where you would push it, because I'm continually trying to think and rethink this. But I see it as honoring the innate dignity of others. So I'm not, compassionate in the sense that I'm feeling sorry for these losers that I'm here to save, right, or fix or lead. I'm acknowledging the full context of their lives, that they have families, communities, friendships, causes that matter to them. And recognizing, this is actually consistent with what you were saying in the intro, Sharnae, that people who are valued create value. It's a very different ethos than the kind of like human resource from the perspective of it's like money. It's meant to be used and it can be replaced. And in some of our organizations, churn becomes the norm. It's not sustainable. So people can't stay. So we even build an infrastructure, new classes of interns, like building out ways of doing business, doing our work that replace, as opposed to work in these ways. And this is complicated stuff. It's like, this definition doesn't solve the million questions of what does it look like? What can I do if I'm a low resource organization that is trying to support someone in this way? There's a million follow-up questions, right? But if we don't even have an ethos that people who are valued create value, there is no way we're going to get from here to there. I'm going to skip ahead to get to a couple more key points from belonging. And I think kind of to wrap this compassion piece, recognizing like there's always pain in the room. I think COVID was really powerful reminder for many people who didn't have that top of mind. And not only is there pain in the room in the communities we're serving, but there's pain in the room, in our room that we're sitting in ourselves, in our own internal people. So I'll skip through the kind of, let me move to the belongingness. So I want to really hit on a few key components here. Belongingness is more than I feel comfortable. It's individuals need to feel like they're being treated fairly. They need to feel respected by, comfortable with their colleagues, a sense of connection to people they work with, that they're contributing to meaningful work outcomes. One of the things I've really appreciated out of the work I've done with NASA is it is 1,000% clear that like if you talk to astronauts and you're like, wow, it's so amazing what you've done, you never hear them not giving like real weight to all of the engineers and the mechanics and all the people, like, because it's so heightened, that sense of if one mechanic with one screwdriver messes up, that's my life. But how can we really, create this outside of a life and death situation? One of the researcher whose work I love, Dr. Amy Rosnetsky, interviewed janitors in hospitals and to try to understand the different mindsets they had about their work. And there was a subgroup of people who described themselves as an instrumental part of the care team, that if I don't do my job well, infection will spread and people will die. So in any role, this is possible, but it requires having that value for your people, communicating the importance of their role, not just to them, but to everyone around them, and holding that kind of culture. So when we lack belongingness, I mean, there's a ton of really interesting research, but I want to make sure to also give you some of the what can I do's about it. But I think important to understand when people don't experience a sense of belonging, I think we've all as human beings been in environments we didn't feel a sense of belonging in. It uses up a ton of our cognitive resources. I can't think well, make great decisions, perform well when I feel kind of existential misalignment with my environment. So you're not getting the best from people or giving the best to them. And one of the pieces that drives me a little bit nuts with this focus on like hiring diversity. Of course, we want to hire diversity, but then don't leave people with feeling like, completely overwhelmed by the environment once they're there. That there's a long tail on the commitment to creating ongoing understanding the environment that people are experiencing and how they're experiencing it differently. And there's, the upshot of kind of the research on belonging is there's a huge amount, micro exclusions. If you look on the left, immediate 25% decline in someone's work, immediate, right? And if you look on the right here, 42% of American employees experience political disagreements in the workplace, and they don't feel accepted. So again, like I'm thinking a lot about like, how can we approach this next election cycle in workplaces, even in our communities, in ways that keep this kind of belonging, safety, foster dialogue. I mean, these are complicated questions. Having even one reliable, supportive colleague at work matters for belongingness. And so there's things from an organizational level you can do, like give them a coffee, give every employee a coffee card and encourage them to go have a conversation with someone else. And if it's virtual, it's virtual, right? And getting to build relationships, giving questions, prompts to get to know each other around values, life story, doing this work, and even having it land with one person. Understanding that belonging is a process that we co-create over time. It is not a one and done. And so we need to talk about how are we doing at this? Like, I'm kind of rolling my eyes because I'm thinking about, like, my kids are really now into like giving me performance feedback as their parent. And especially like about how I'm parenting their siblings, which is fascinating. But I want to normalize like conversations, like what are we doing in the workplace? What are we doing that's working and not working? Having those conversations, but also collecting the data so it doesn't put the burden only on people to speak up. Because if I'm the leader and I'm the manager and I'm asking this, it might take a minute for people to feel comfortable enough to express what's not working. But I can say, I want to work on this. I know it's hard work and over time. And here's where we are at. And here's what we're going to do. And then there's just like really basic things like round robin. How do we structure meetings so it's not the same loudmouths like me talking all the time, but you're going around the room and making sure to hit folks who wouldn't speak up, or giving them opportunities if they're an introvert to process and come back to the idea and bring their contribution in the next meeting or in some follow-up process. So it's not only highlighting the extroverts who realize what they think by speaking. And then, there's some interesting, Google, again, complex organization, not saying anything otherwise, but they had an interesting blue dot initiative, big organization, where people were putting a blue dot on their badge to signify that they wanted to be part of this conversation, that it was important to them. So I'm here to hear about your mental health. I'm here to hear about that microaggression. I want to do this work with you. I think something like that, especially in a big organization, can be really helpful. And doing the education, like there's so many kinds of unconscious bias that exist and so many different experiences of this unconscious bias. So understanding, making sure we as leaders, our managers, our people, we approach this work and say, we as human beings are wired to have bias. And so let's engage that. Let's recognize what these types are so we can name them when they come up, not to call each other out as, canceling each other, but to improve together, which we can only do by having these conversations. And there's all kinds of work that we can do internally, noticing how are we showing up physically with our ideas, with our emotional reactions, and what is happening with others, right? And I train my MBA students at Stanford. Many of them, are not the most attuned to the nuance of what other people's physical posture is showing about how they're feeling. But like, I really want to get them, they're going to be powerful in their organizations. I want to get them out there and understanding when someone's voice changes or they're sitting in a whatever posture, there's something happening for them. So what are you noticing? What are you doing? And this came up, sorry about the formatting here. How do you get this feedback, give this feedback after the fact? Can you have kind of practice circles or a practice partner or someone from your team that after the fact you can debrief like, hey, we just had a really hard conversation. I'm curious to hear how you saw me showing up and get feedback from you about how you experienced, especially if you're a leader, like inviting some of that over time is really powerful. And then I think, kind of a last idea before I see if there's any kind of final comments, I guess I can stay for a few minutes, but I know a lot of you probably need to drop. I think the measurement is really important for destigmatizing the information gathering. It's very hard for someone to speak up if they're the only person of color, they're the oldest on the team, whatever the thing is, if they have to speak up real time, very difficult to put that expectation on them. But if you use data, you can get that information without making them have to go through that burden. So it accounts for power dynamics. And then if you know where you're strong and weak, if you know we're really strong on values, we are really strong on purpose, we're really weak on autonomy. let's say. So let's address that, or let's work on our belonging, and here's how we're going to do it. And it's important that we measure with the right questions at the right level. When you want to take action, I always tell people who ask me like, oh, what are the questions to ask? Don't ask if you're not going to listen and if you're not going to do something about it, because you actually make your people more frustrated. If you start, pretending that you care about culture, they'll see it that way. If you ask but don't respond. So these are just examples of some of the questions that go in measures. And then we can share out. I'm happy, as I said, this your work is important to me. If I can be a resource for you, I'm not always the most quick, but I will get there. So you're welcome to take my email down. Here's a couple of resources that I'm happy to share. And I'm also, happy to think about if you're like, hey, this narrative purpose work is something I really want. I'm happy to like shoot you over, examples or more. Let me know how I can be supportive. Charnay put a link here, and I only wish I had more time with all of you. Thank you for taking the time to be here and to share your experiences on these concepts. I'm happy to share. We can share I'll send you, Charnay, a PDF of it so folks can have it. Thank you.
Thank you so much, Leah. We can all just give a round of applause. This was amazing and so insightful. Really, really appreciate your time today. And thank you everyone for showing up. And we'll definitely share this recording as well as the slides. If you all would like to say any final words before heading off to another meeting or another engagement, I hope you all enjoy the rest of your day. And thank you so much for your time. And thank you again, Leah. This was absolutely phenomenal. Thank you.